by thanking Representative Flowers and Representative Shattuck-HB for having me here and for their leadership on this bill. And I also wanted to take some time to thank you, the people, for being here, because you are why we're all here. And I wanted to thank you for sharing your stories. I will be sharing Beth Schwebke from Aurora's story today. I testified in the Chicago hearing about what it's like for people my age, young people, to get health care right now, and I'm hoping that this presents a little bit of a different perspective from Beth. Beth says, I am currently in my 50s and I'm paying for the Illinois Comprehensive Health Insurance Plan out of pocket in the amount of $769 a month. Thank goodness I qualified for this coverage. Otherwise, I would not have any health insurance at all. However, the premium is more than half of my take-home pay each month. This means I am paying for it by running up my credit card bills. And recently I had to cash in and take a huge penalty on one of my retirement plans. I have one more retirement plan, and if something doesn't change soon, I will be cashing in that plan as well in a couple of months. The reason I will no longer have any retirement funds is so that I can hold on to the only health insurance plan I am able to obtain. When those funds are exhausted, I guess I will be out of luck. Like many Americans, I paid health insurance premiums for years and years. During the course of those years, the amount paid in my behalf by the group health carrier was far less than the amount I paid for the coverage. Now that I am older and have pre-existing conditions, I cannot obtain affordable health insurance. And I am not alone. I have talked to several people in my age bracket who, like myself, have been displaced in the job market and can no longer obtain any health insurance because it is not available to us, and any that is available, such as what I have through the state of Illinois, is too expensive. In the last 2 years, I have applied for over 300 jobs. If I am fortunate enough to get an interview, you can see it in their eyes. They're looking for someone younger. And the pool of employers who will hire older Americans at decent rates of pay and benefits is extremely limited. Part-time positions, for the most part, do not offer health benefits. Right now, I am employed part-time and make a reasonable amount of money, but it's not enough to cover everyday living expenses and the health insurance premium each month. I love my job and I want to continue working there, but I am not going to survive much longer unless I can obtain affordable health insurance. Beth says, I beg you to pass HB 311 so that I do not become desolate. Thank you for taking the time to listen to my story, and please offer the residents of Illinois the opportunity to receive affordable health care. Beth Schwebke, Aurora, Illinois resident and registered voter.
Are there any questions of Beth? Rachel?
I have one. Is the state representative you're running against on our bill?
No, he's not.
Who is it?
Tim Schmidt.
Oh.
Yeah. Well, you heard with the others that testified here today. You know, you need to take it to the people and explain to them how this bill is going to impact their lives and their livelihood as well as their children. And I wish you the best of luck, and I look forward to working with you in Springfield on this issue.